Good morning. There is no doubt that as a nation, we are faced with numerous challenges in the health system. When in government, the SLP experienced firsthand the situation and took positive steps to improve healthcare. In 2002, we commenced and later completed the National Wellness Center to ensure more humane treatment for our mentally ill people. In 2002, a decision was taken to construct a new hospital. After review of existing plans to rehabilitate Victoria Hospital, built in 1887. Construction of the new hospital commenced in 2005. The OKE hospital was not completed during the United Workers' Party term of office from 2006 to 2011. I repeat, the UWP did not complete the OKE hospital in the 5 years between 2006 and 2011, despite the fact that European Union funding was already available. Yet, when the SLP assumed office in 2011, it never stopped work. Instead, it continued work, bringing the hospital to completion. Not a day was wasted by the Labour government bellyaching about the UWP not completing the hospital. Like we did with the St. Jude reconstruction project, we kept working. This is what responsible government does. It does not play reckless games with the lives of its citizens. By April 2015, progress on commissioning of the OKU was progressing and a new director was appointed. All major construction work had been completed by February 2016, and ancillary works were in progress. All equipment had been procured and expected to be installed, commissioned, and training completed by September 2016. On September 9, 2009, during the United Workers' Party term of office, there was a fatal fire at the St. Jude Hospital in Vieux-Fort, which forced St. Jude Hospital to be displaced and temporarily housed at the George Odlum Stadium. The UWP started construction of the hospital in 2011 on the existing site, and returning to power in 2016, the St. Lucia Labour Party government continued construction. The St. Lucia Labour Party government obtained a loan from the government of Taiwan to continue work on the hospital. The SLP was voted out of government in June 2016. At the time, the OKU was not fully commissioned, nor was the St. Jude Hospital completed. One of the main promises made by the electorate, to the electorate by the UWP, was to complete and occupy both hospitals and to improve the healthcare system as an immediate and urgent priority. How has the UWP government fulfilled this promise in its 26 months in government? Work was stopped at the St. Jude Hospital and has been for the last 2 years. Then the government commissioned a technical audit on the reconstruction of St. Jude Hospital, costing about $1 million. To date, the report has not been tabled in Parliament, even if it has been leaked to the media. Then the government announced that it was going to demolish St. Jude Hospital because it did not meet international standards. Then the government retracted, saying that only parts of the hospital would be demolished. The government later announced that a new hospital adjacent to the existing St. Jude Hospital would be constructed. It was then announced that the government was discussing the privatizing of the OKEU with several interested parties. However, media reports were that the government was in final negotiations with Health City Cayman to take over the management and operations of the hospital. The government clashes with the St. Lucia Medical and Dental Association over consultations and dialogue on the way forward for the health system in St. Lucia, and savagely attacks medical professionals. It was then reported that Health City Cayman, on taking over the operation of OKU, wished to have a clean slate, including the right to hire their own staff and personnel. The government denies this. The government announces that it intended to implement a universal health insurance scheme and was discussing the scheme with a number of companies. No details were given. The Prime Minister announces that national insurance premiums will be increased to help fund the universal health insurance. It's announced that every St. Lucian will receive $100,000 in coverage, with government paying the premium for the poor, children, and elderly. The government then says it will now use the parts of the St. Jude Hospital site for the St. Jude Hospital. No details are given for what will be done with the rest of the buildings. The poor state of the George Orlam Stadium becomes a major cause of concern. The rapidly worsening conditions results in the then chairman of the board of St. Jude Hospital calling the facility a hell hole. The chairman, Dr. Eric Mondesi, a former UDAP candidate, resigns. The government agrees to do some work costing $12 million, as announced by the Minister of Economic Affairs. The work was poorly planned, causing major hazards to the health and safety of patients and personnel. The Labor Department stopped the work. At least one doctor is hospitalized for negative reactions to fiberglass-like material removed from the roof of George Orlam Stadium. And only on Monday, we heard the Prime Minister present an update. It appears, from what the Prime Minister was saying, that the Victoria Hospital will be closed. Instead, the Victoria Hospital will not be closed. Instead, we'll be entering into a joint venture, note a joint venture, with Health City Cayman to turn OKEU into a tertiary health institution, offering, in his words, services that currently don't exist in St. Lucia. That is a direct quote from the Prime Minister. Services that currently don't exist in St. Lucia. The Prime Minister also explained that our population cannot sustain a tertiary level hospital. The only way we can commission the OKU hospital in St. Lucia is to have medical tourism. It appears that the OKU hospital will be used primarily as a hospital for medical tourism. In effect, what the Prime Minister is saying is that Victoria Hospital will remain open and the OKU will be used for medical tourism. This is the chronology of confusion, failure, and gross incompetence. The health system is in a deep, deep crisis. The government has approached the health care of the people with insensitivity and callousness. While St. Lucians are dying, yes, dying, according to doctors, because of the state of our health system, the government is toying with misconceived ideas and playing with the assets and health of the people. The UDAP government is victimizing and attempting to divide medical people who are expressing concern at the state of health care in our island. Our nurses continue to be concerned about their future tenure in the system. We need to stop this government. We need to send a clear signal that the people of St. Lucia cannot take it anymore. Therefore, on September the 9th, we'll assemble on the VG playing field and march to the market steps to send a collective statement to the government that we cannot take it anymore. We need the completion of the West Wing at St. Jude Hospital site to allow the hospital to be removed from the George Orlam Stadium. We need the St. Jude Hospital to be completed. We need a complete commissioning of the OKU to serve as a national hospital, offering affordable and accessible health care to all. We need the establishment of a national health fund that will provide for the financing of a universal health care system. The national health care crisis continues to stagnate and worsen as this administration finds itself hamstrung and unable to advance its health mandate promised to the people of St. Lucia. It is yet to put forward to the public a policy document with its plans to resolve this crisis. Lack of public consultation on health care continues to be a matter of serious concern. The time has come to publicly hold this UDAP administration accountable for this lack of transparent progress on health care. The public must be honestly informed and assured of the way forward on health care with immediacy. While the health crisis intensifies. The recklessness of the UWP government is manifested in many other senseless decisions, like range, the Unero airport loan, and an increase in gas taxes. This madness must stop. Let us demonstrate that we will not allow the bleeding of our nation to continue. Let us take a stand on September the 9th. Let us take a stand on September the 9th. I thank you.